There's a secret sauce that helps the Mielscope become such a powerful tool to the dentist. With traditional dental microscopes, sometimes doctors find that only a small part of the field of view is in focus. However, with the Mielscope, they are seeing more detailed imagery across the entire screen. The main reason for this is that the Mielscope has a very large depth of field. Here's how it works. The depth of field is the range of distance from the scope that the object has to be in order to be in focus. This picture refers to photography, but it's the same concept. Think of it as your margin of error. Too close or too far will result in out-of-focus images. Having a shallow or narrow depth of field can have a big effect on how useful the microscope is in at least two ways. First, a small depth of field means that small movements, for instance, small movements by the patient, the operator, or the unit, can cause the entire view to lose focus, which means the operator may have to stop and adjust. Secondly, only part of the screen may be in focus because typically the anatomy is not absolutely flat. Now, quantitatively comparing depths of field can be tricky because, for all devices, the depth of field changes as you change the magnification. However, one paper measured the depth of field for 3 popular dental microscope models across different magnification levels. They found that the depth varied from about 2 millimeters to 6 millimeters depending on the magnification level. The Mielscope, on the other hand, has dramatically larger depths of field at these different magnification levels. This is important because this large depth of field, in combination with the magnification levels and the 4K resolution that a Mielscope offers, means that doctors are able to see fantastic detail across the entire field of view. However, this is also a large reason why the system is so easy to use as compared to a traditional microscope that has very little room for error in positioning of both the scope and the anatomy.